Hi, I am Sarah Jane. I'm a podiatrist, and in this video, I'm going to talk to you about the different treatment options that we have here at the Rehab Hub in Glasgow. And we are experts at treating verrucas. So, we use a treatment called Swift. It's one of the most innovative treatments for verrucas and warts. So, not only do we treat feet for this problem, but also we can do your hands and anywhere associated that you may have warts. So they're only called verrucas when they're on your feet. Anywhere else in your body, they are called warts. So the system that we use, if I just kind of move this down, I'll show you, is the Swift. And this is the machine here. And essentially, switch it on. What happens is after each treatment, so this one, I've just carried out a treatment just now, and this tip here, I'm going to take off, and that will go into the bin because they are single use. And then a new tip from here, so inside this box, we have lots of new tips, and that would then go on. So each patient is only this end that is touching them. And essentially, there'd be a new single use tip put on, and we would be putting in a certain number of watts for a certain duration, a certain time. And essentially, what this treatment means is that there's no blood, there's no ghouls, there's no need for local anaesthetic, there is no aftercare required for you. Essentially, it's super easy. You come in, the treatment itself takes 10 seconds, and you have nothing to do in between your appointments. Generally, most people will need 3 treatments, but it does depend on your verruca, how long you've had it. There's lots of variables there. So you could need maybe 4 treatments. You generally, with us, will come in and pay for each treatment as and when required. And so you would normally have 1 treatment, and then 4 weeks later have another treatment, then 4 weeks later have another treatment. And we'd be reviewing that throughout. For some people, we would see them for a 4th month, but generally after the 3rd treatment, we would usually see you after 3 months and review then, and usually by then it's gone. But it does just depend on the patient. So some people need 3, some people need 4. And if you've had your verruca for a significant length of time, then you may need up to 6 treatments over the course of quite a few months. So that's how it works. It is microwave technology that goes through. So I grab one of these little leaflets. This is from the company Swift. And on their brochure, pretty much say it is seconds, and it genuinely is. We generally will put through 10 watts for 2 seconds 5 times. That is the treatment. Warts, plantar warts, are caused by a virus. They're caused by the human papillomavirus, and you might have caught this from your kids. It might have been in the shower. It might have been when you've been swimming. Sometimes you've maybe been a wee bout of being run down. So it is your immune system that's not picking up these. Many people, by the time they've come into us, they have tried everything over the counter. They've been to the pharmacy, they've been to the GP, and they've had prescription, maybe salicylic acid on it. They maybe had it frozen, and it's not worked. It's not resolved. So Swift is a treatment that the success rate is very high. For the majority of our patients so far, we're getting full resolution. There's a few that we're working on just now that are a wee bit more stubborn, that we're maybe on to the 4th treatment. So we'll see how they do. But other than that, we've had 100% resolution for all of our patients, which is phenomenal. In terms of what you feel when you're getting it, it feels hot. It's not unbearable. And we can reduce the wattage down for children. So the youngest that we have treated to date is age 4. And they tolerated it really well. And that particular patient only needed 1 treatment. Generally, children have a great response to it. Adults, sometimes we can be a bit more stubborn and maybe needing the 3-4 treatments. For adults, kids tend to bounce back. They tend to get a good resolution. So that is Swift. It's really simple. It's really easy. It's really quick. It's very effective. If you're struggling with a verruca and you're really looking for something else, a new solution, then why not come in for a free consultation? You can come in and immediately have a free consultation, and we will assess, or myself, I'll assess that verruca and make sure it is a verruca, and then talk to you about your different options that you have. Should you wish to progress with treatment, usually we can do treatment on the day if you want to. Or not. Maybe you just want a wee bit of advice. Maybe you just want it looked over. So whatever it is, don't hesitate to book a free consultation. We'd be happy to assist you and happy to help you get a resolution to your Verruca or